Healthy Homes Initiative, we're an organization headquartered in Baltimore, Maryland. We've been doing in-home asthma interventions since around 1999, and we also operate in 21 other cities around the country. And our model is really around, can we take any resources around housing, home visiting, housing rehab services, and braid them all together. And so we're talking about funding from HUD, whether it be Healthy Homes Funds, CDBG, weatherization resources that can do home improvements, sort of any sort of funding that may touch a home. In our cities that we work in, we work to collaborate and get all those sort of resources aligned up together and delivered at the same time, and doing a comprehensive assessment of the home for those interventions. And when we're looking at sort of, these funding resources that we were braiding together, we found that we did not have the sort of healthcare related resources going into our home interventions, where we touched the sort of gamut of other funding resources. And so we tried to sort of more deliberately look at how we would make that case to get more funding directly from healthcare. And one thing, I just want to sort of remark on is that these in-home interventions, whether it's the in-home self-management education or environmental assessment and repairs, are part of guidelines-based care. It's not guidelines if we have the money, guidelines if we can, but this is actual guidelines-based care, NAEPP guidelines, and I always want to, we sort of go, we use that stance when we reach out to payers. And so, in our model, we assess the home at the same time that we deliver self-management education, and then we take a scope of work based off of that information, and then deliver interventions such as, mattress and pillow covers. We rip up carpet if there's mold. We address water infiltration, provide venting to improve air quality, a whole set of services, but they're all sort of services that you can find in the NIH guidelines for environmental control. And when we were sort of approaching healthcare payers, we first did a study of sort of our results and found some good improvements on in-home hospitalizations and emergency department visits. And with funding, with generous support from HUD, we're right in the middle of a Healthy Homes technical study where we're actually matching claims records for all of our patients that are part of Medicaid in Maryland, and comparing their results over time in terms of medical utilization with a match-based comparison group of other asthmatics. And when we're thinking about the business case, obviously you have to think about what is the cost. And so in Baltimore, for example, for every hospitalization avoided, that's about $7,500. For every emergency department visit avoided, that's about $820. And so we went to we actually worked with Johns Hopkins to say, okay, we show these great results and we're saving the payer money, so how can we sort of figure out how we can bring more investment in? And so we developed a pay-for-success model where, starting on the left side, you can see we've got outside investors, private investors. So Calvert Foundation, despite their name, they're not a foundation, they're an impact investing firm. And they had heard about our work and said, we would like to invest in GHHI home interventions, and we would invest up to $10 million to pay for home interventions for asthmatics, but we need our money back. We need a return. And so Calvert Foundation with other investors are going to provide capital to pay for GHHI home interventions for high flyers, those asthma patients that are going back and forth to the hospital, going back and forth to the emergency room. And so we are developing a deal right now with Johns Hopkins with their Medicaid health plan. So if you go on the other side of the screen, Priority Partners, that's Hopkins Medicaid health plan, where there would be a contract, basically, where we would track the utilization over time of these high flyer asthmatics that receive GHHI interventions, and then based off of the savings in avoided hospitalizations, avoided emergency room department visits, a portion of those savings would be paid by Priority Partners back to our investors. And obviously there's a lot of tremendous detail and actuarial projections and savings projections that go into that. So we're working with Milliman, that's in the upper right side of the screen, a big national actuarial firm, to sort of set the savings projections over time. So they're basically taking a multi-year look at these asthmatics that are sort of the high utilizers and saying, okay, this is what we would project those same asthmatics would cost Hopkins over time without having an environmental intervention, and then what would the potential savings be with that intervention. And then at the bottom of the screen, Hilltop Institute. So once we launch this project, we'll have to have an independent evaluator to determine whether or not we're actually hitting those outcomes in terms of reducing medical utilization. Because under this model, the health plan only pays if those outcomes in medical utilization are met. If they're not met, then the investors would lose their money. And so the risk, and when we talk about ways in which to incentivize health plans to sort of look at different payment models, this is a way in which there's no upfront risk at all to priority partners. The risk is is basically with the investors that GHHI will be able to produce the reduction in medical utilization. And we're actually working on replicating this model with 5 other health systems around the country, one in New York, Monroe Plan / now Your Care in Buffalo, I think Joe spoke earlier, as well as Bay State Health, Le Bonheur Children's Hospital in Memphis, Tennessee, Spectrum Health in Grand Rapids, Michigan, and University of Utah Health Plans out in Salt Lake. And I'd say, when we talk about building the business case, so right now we're developing a prospectus that would go along with all those projects, where we're sort of mapping out the actual process flow of getting those high flyer asthmatics to the home-based service providers in all the areas, the actual savings projections, return on investment, basically, developing a full sort of investment prospectus. And in the upcoming year, we'll be going to local and national funders in those areas to reach those investors. Thanks. 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 Thanks.